The use of MATRx titration trays and the MATRx scale allows sleep physicians to identify patients whose airway will respond to mandibular advancement and enables the dentist to deliver immediate therapeutic benefit with somnodent therapy. This video will review how to take the measurements needed for the MATRx titration study and how to convert the MATRx study output, also known as the MATRx number, to a somnodent appliance. The MATRx tray scale, graduated in millimeters, is located on the upper tray. The MATRx scale indicator, located on the lower tray, is the red line that runs between the lower tray indicators. The scale reading is verified by determining the position of the red scale indicator on the lower tray as it shows through the scale on the upper tray. The trays are mounted on this model to show you how easily the trays should move from edge to edge to full protrusion and then back to full retrusion. Now let's have our patient move the trays to full protrusion and retrusion and record the scale readings needed for the MATRx study. The scale readings needed to conduct the patient's titration study are the habitual bite position, the full protrusive position, and the full retrusive position. The first scale reading is the patient's habitual bite position. With the trays in place, ask the patient to establish their most comfortable bite position. In this case, the patient's habitual bite position is 13. The second scale reading is the patient's full protrusive position. Ask the patient to slowly move their jaw forward as far as possible. In this case, the patient's full protrusive position is 19. The third and final scale reading is the patient's full retrusive position. Ask the patient to slowly move their lower jaw backward as far as possible. In this case, the patient's full retrusive position is 10. These scale readings should be repeated 3 times to confirm accuracy. Once you have verified the accuracy of the patient's scale readings, record these measurements in the patient's prescription card. These readings will be needed by the sleep lab on the night of the patient's titration study. To prepare the patient's trays for transport to the sleep lab, rinse each tray under cold tap water for 30 seconds. Once clean, dry the trays and then place them in the tray case. Place the tray case in the titration tray box along with the patient prescription card and the patient information brochure. Your patient is now ready to proceed to your local sleep lab for an attended MATRx titration study.